Most parents with young kids know about hand, foot, and mouth disease. It's a contagious virus that can come with mouth sores, fever, and rashes on feet and hands. In the last number of weeks, pediatricians in the GTA are seeing a spike in cases. Dr. Dina Kulik is a pediatrician in Toronto. Dr. Kulik, good afternoon to you. What are you seeing in your office when it comes to hand, foot, and mouth disease?
Thank you for having me. We have seen a lot of cases of hand, foot, and mouth, not just in recent weeks, but I would say maybe the last 2 or 3 months. I have never in my career seen so many kids and their parents sometimes as well with the same illness. We don't usually see it happening with such frequency.
How about your colleagues outside of Toronto? What have you heard about what they're seeing?
Yeah, not just in Toronto for sure. So many hospitals across the country are saying they have huge volumes. CHEO recently, Sick Kids has commented on this across the country, and even down into the States, they've been speaking about the very high viral volumes that they're seeing, very uncharacteristic for July.
I touched on this briefly in the intro, but tell us more about the symptoms. What do people experience when they get hand, foot, and mouth disease?
So most children and adults that get it will have sore throat, sometimes fever. A lot of children will complain of mouth pain and have less appetite because of that. And that is usually followed by a rash, most classically little pimples on the hands, on the feet, around the diaper area, and around and in the mouth. But some children will have rash everywhere, and some only have a few pimples. It's really varied.
How long does it take to cycle through? How long is somebody sick with this?
Typically between 5 and 7 days.
And I know it's difficult to pinpoint, but what's your sense of why we are seeing more cases now?
It's a great question. We don't really know. I've never seen so much hand, foot, and mouth in my career in one time, and it's not the normal season for it. We usually see this as more of a typical fall and winter kind of virus, typically caused by a virus called Coxsackie virus. This is an odd time for it, and it's very, very prevalent. I'm also seeing a lot of adults with it, which is not very typical. So I've questioned over the last number of months whether this could be a presentation of COVID or a post-COVID kind of illness, because a lot of my patients are testing positive at the same time as having hand, foot, and mouth, or family members have, or they had recent hand, foot, and mouth and now have this rash. I think we don't quite know yet.
Mm-hmm. So you're saying it could be associated perhaps with long COVID?
Perhaps, or acute COVID infection, because some of my families, for example, 2 children will have hand, foot, and mouth, and the parents will have other classic signs of COVID at the exact same time.
Mm-hmm. I know this disease, it primarily affects kids, but adults can get it too. What do parents need to know about keeping them healthy as well?
I think the biggest thing is staying home if you're sick, so we're not infecting other people. It is quite contagious and quite prevalent. We want to make sure that kids and adults are drinking well. Many people will have less appetite because it hurts the throat and it makes them feel pretty achy and crummy. So ensuring that kids are drinking enough soft, cold things like ice cream or popsicles or yogurt can be really helpful. But if a child doesn't have great appetite, I'm not usually very fussed by that. We do want to make sure they're drinking a bit. And then pain management, so using acetaminophen or ibuprofen for the fever, for the pain, knowing that after a few days, most people are feeling a lot better.
Mm-hmm. So if you suspect your child has it, just primarily, or first thing you do, make sure that they stay home?
Stay home so you're not infecting other people, keep them comfortable with pain management, and make sure they're drinking.
What is your message to parents who are hearing there's more cases and may be concerned about it?
A lot of families get very nervous when kids are not eating well, or they're in pain, of course, but it is usually a short-lived virus. It doesn't scar the skin, even if they have lots of rash. Many parents are concerned about scarring. It does not do that. The rash will fade away on its own. But I feel like a lot of families are eager to return to normal. And if they do COVID testing and it's negative, they go right back to daycare and school and camps and whatnot. And then other kids get infected. So I can't hammer home enough that if we're sick, we really should be at home. This is advice I gave before COVID and will continue to do.
All right, Dr. Kulik, thank you very much for this.
You're welcome.